Rebecca Smith, Marketing and Education Coordinator at the Alzheimer's Alliance of Smith County.
And how long have you been here?
I've been here, it was a year in March.
A year in March. And what made you decide to take a job here?
I covered nonprofits at the paper, so I knew that this was an excellent place. They do a lot of good work here. And my grandfather had Alzheimer's, so I really feel for the families who come through here and how difficult and heartbreaking it can be to have a family member go through any kind of dementia. So that brought me here.
So I'm sure you've heard about it, and I know you said it's been on y'all's radar, but the FDA is potentially going to approve a new Alzheimer's drug called Leqembi today, and really what they're expecting this to do is allow Medicare to come in and start offering coverage for it, because as of right now it's over $26,000 for people to pay out of pocket. That's really not feasible for a lot of people, so I just wanted to get your perspective on what kind of an effect you think this is going to have on the families of Smith County and anyone who's affected by dementia or Alzheimer's.
We're really excited about any kind of treatment. There just aren't good treatments for Alzheimer's and dementia right now. And it's such a frustrating situation for families to be in. So any kind of treatment that can come alongside and slow the disease is going to be a win in our book. The support that we offer is social support and lots of social engagement for people living with Alzheimer's. So in combination with medication, hopefully can improve their quality of life for a long time.
And how would y'all be able to help this community get access to this drug if it is approved? Would y'all just offer information on it, or what would that look like?
Sure. So we do offer information. We have a case manager who meets with clients and can kind of help them navigate the ins and outs of what to expect when they get a dementia diagnosis. And of course counseling and emotional support as well. So we can let them know about the drug. All of our supports that we have here are social as opposed to medical. But we're just so excited that we have another option to present to families who come in here looking for answers after they get this diagnosis.
And how many families would you say y'all help?
We see about 1,200 families a year. That's growing a lot. We really, since we've moved into this new building, have beefed up our numbers. And we know the need is out there. They estimate that 1 in 3 seniors over 65 will develop some kind of dementia in their lifetime. So, and with the rise of the baby boomers, that number is going to just keep getting bigger. So we hope to be able to expand our services to meet the need. And this is just going to help us do that.
Yeah, absolutely. So this drug, as of right now, is only being approved for those with early onset dementia or Alzheimer's, just because I'm assuming, younger bodies are probably more equipped to handle the drug. Mm-hmm. So do y'all see numbers of early onset patients or families who are affected by that?
We do see some early onset. Unfortunately, a lot of times people wait a little too late to address the issue, so we really encourage people to come if they have any concerns about their memory. They can come here and do a free memory screening. It's a very easy 10-minute test that we do on Fridays, and then if they don't do well on that, they can talk to their doctor about it and be sure and get an early diagnosis, because the earlier that you know, there's more treatments that can be offered the earlier that you know, and you really can improve your quality of life for longer with an early diagnosis.
So anyone who is maybe curious about their memory or has noticed maybe they think something is off, what would you recommend for them to do?
I would recommend they give us a call and they can set an appointment to do a memory screening that we offer for free on Fridays, and then we can take it from there. It may be, they're just concerned and they do well on the test, and that's fine, but then they have a nice baseline and we can do that exam just as you would any other annual screening to do preventative health for yourself.
And do y'all offer any, because I know y'all are a nonprofit, do you offer any financial services to people who come in here who might be looking for assistance to receive medication or doctor's appointments?
So we don't offer financial assistance for medical treatments. We have services such as our counseling, which we offer scholarships for. So if someone, of course, many families need counseling as they go through this journey with dementia. So that's a service that we can offer for free if they need financial assistance with that. But as far as assistance for medical, we don't offer that at this time.
Okay. And going back to, I know you said that your grandfather actually suffered from, was it dementia or Alzheimer's?
Alzheimer's. So just as an FYI, dementia is an umbrella term of a group of symptoms. Alzheimer's is under that umbrella with a lot of other kinds of dementia as well. It's just one of the many kinds of dementia.
My grandmother had dementia, but they never called it Alzheimer's.
If she never got a formal diagnosis, a lot of times people will say just dementia.
Anyway, so how do you think an FDA approval or a drug like this could have changed the lives of people in your family, and specifically your grandfather?
Oh gosh, you might make me a little emotional. It would have been wonderful to have more time with him, because he got so confused so fast. So just to give families more time it's a beautiful thing.